Good morning. Thank you for joining us today. The purpose of this press conference is to provide a wellness update for the Norman community. Our city, state, and nation are still very much in the grips of the COVID-19 pandemic, and we all need to do our part to care for ourselves and loved ones and support each other. As of this past Tuesday, here in Norman, all COVID-19 ordinances are extended to March 1st. The mask mandate, particularly, is one that is very, very important. The CDC released information this week that masks protect not only others, but yourself. From wearing seatbelts and exercising to taking our vitamins and going to the dentist, wearing a mask needs to be added to that list of easy things we can all do to protect ourselves. The latest state epidemiology report finds that from August 1 to November 1st, the parts of the state without mask mandates experienced a 109% increase in infections compared to a 34% rise in cities with ordinances. Gatherings and parties over 25 people on private property will still be required to wear masks. This is very important to note as we go into the holidays. We urge you to be very, very careful with social gatherings during this time. Further, council meetings will change beginning November 24th. Due to the state legislature's refusal to call a special session to extend our ability to meet virtually, every city, county, and governing agency in the state will have to go back to in-person meetings, despite our numbers of new cases, hospitalizations, and deaths continuing to rise. The changes that you can expect are put in place with the intention to reduce the amount of time for exposure. Miscellaneous comments for both council and residents will be canceled, but residents can still connect with council via email. Council study sessions and boards and commission meetings will be canceled unless they deal with time-sensitive business. I cannot, in good conscience, ask our volunteers, both of residents and council members, to risk their health during the peak of the COVID-19 pandemic. But our city must continue on, and we must get our business done, and we will try to do so as safely as humanly possible. A few other city announcements. Not only are people suffering, but our businesses are suffering. As we approach the holidays, I urge you to shop local. On Saturday, November 28th, here in Norman, it is Shop Small Saturday. And remember, when you support a small business, you support families, you support children, and you support local economies. Not so much pandemic related, but please be aware that you can take downed limbs from the October ice storm to Griffin Park tomorrow, November 14th from 8 to 4 p.m. I'm now going to turn it over to Richie Splitt, our President and CEO of Norman Regional Health System, to provide some updates on the excellent care we're providing here in Norman at Norman Regional Health System.
My name is Richie Splitt. I am the President and CEO of Norman Regional Health System. So thank you, Mayor, and thank you for bringing us all together today. Thank you all for being here. Norman Regional truly values this opportunity and certainly our partnership with you and the city, the rest of the city staff, so we're grateful to be here. My remarks this morning will be followed by Brittany McGill, our Chief Nursing Officer, and Dr. Aaron Boyd, our Chief Medical Officer. The three of us are here representing the 3,500 employees of Norman Regional Health System, and we call each of those employees healers because they have the power to alleviate distress and anxiety and to restore health and wellness. And as such, I'm going to start by saying thank you to those healers, including our award-winning MSTAT ambulance services and the first responders of our great city, police and fire. Thank you for the courage and compassion you pour into your professions. Thank you for your selfless service to others. You often forfeit personal time with your own loved ones in order to care for the loved ones of others. You ease the fear and anxiety that comes from the lack of control of one's personal crisis and failing health condition, and your sacrifices are often unseen. Today, I want to take this opportunity to say to you, we see you and we thank you. Our hearts overflow with gratitude and pride for the work you do every day to keep us safe and healthy. Norman Regional Health System is a nimble organization that strives to be a leader rather than a follower, to be proactive rather than reactive, to be caring rather than callous. And that is especially true for the demands of COVID-19. Since the beginning of this pandemic, Norman Regional has effectively demonstrated each of these traits. In fact, it was February that Norman Regional reached out to the city staff in order to start coordinating our planned response to this potential threat, the coronavirus. Our goal was to simply start to communicate and collaborate our response, and we did that. In March 2020, Norman Regional fully activated our expertise and our resources to battle the novel coronavirus. In March, Norman Regional admitted, if not one of the first hospitalized COVID patients in the state of Oklahoma. Norman Regional collaborated with City of Norman officials and the Emergency Operations Center. We connected with the state and city health departments. We expanded the use of our Xenex germ zapping robots, including the deployment to area nursing homes. We initiated COVID triage assessment locations outside our hospitals and our clinics. We launched our mobile drive-through COVID test sites, provided numerous health experts to assist the mayor in her weekly Facebook updates, retooled our in-house lab services to add equipment, supplies, and personnel, which produced highly reliable test results and even faster turnaround times. We partnered with Emmy Labs, headquartered right here in Norman, to develop highly reliable and effective COVID-19 test kits, including PCR virus kits and the antibody testing. In less than 72 hours, Norman Regional enrolled more than 200 physicians and other providers into our virtual health platform. We did that so our patients could stay connected to their physicians and not avoid health care if at all possible. We initiated Greater Oklahoma City metropolitan peer groups to communicate and coordinate a community plan of care for COVID-19 patients. We coordinated with the governor's team, the state, the county health, the mayor, Oklahoma Hospital Association to develop a statewide COVID surge plan. We implemented convalescent plasma and remdesivir treatment protocols and others for hospitalized COVID-19 patients. Norman Regional was the recipient of numerous community donations, including PPE, food, cards, letters, car lights on Friday nights, personal healer praise parades in our own hospitals. We were designated as one of the state's COVID surge hospitals for the entire state, and Norman Regional was with the state of Oklahoma, one of the first to submit our vaccination distribution plan so that Oklahomans could be protected when the vaccine was readily available. And all while this was happening, we never stopped caring for the patients, any patient, all types, all conditions. In fact, just last week, the incredible healers of Norman Regional Healthplex helped bring into this world the 2020 baby born in Norman, Oklahoma. In our time of greatest need, the healers of Norman Regional Health System, MSTAT Ambulance, Police, and Fire all went above and beyond to deliver amazing care and extraordinary results. We did that for our patients, and we did that for our entire community. And all of that was done in the name of patient and public health, patient and public safety. And we did that because of our passion for health and wellness. Norman Regional Health System is a public trust, not-for-profit health system. And we play an essential role in delivering safe, quality, and trusted health care, not only in Norman, but across our state. We have done that for nearly 75 years. We have done that throughout this pandemic, and we will continue doing that as we go forward. Next, I turn it over to Brittany McGill, Chief Nursing Officer for Norman Regional Health System.
Good morning, my name is Brittany McGill and I'm the Chief Nursing Officer for Norman Regional Health System. I just want to take a moment to reiterate what Richie said. We want to thank and recognize all of our healers within the health system. Every single department within this health system has had to change and customize their operations to meet our patients' needs, and we are happy to do so. Between collaboration and innovation, we have been able to have some remarkable results to respond to this pandemic. Norman Regional Health System has actively been participating and collaborating with the hospitals that are in the metro. We, as Norman, are part of Region 6, and we've been working hand in hand with those facilities in Region 8. Between the Region 6 and 8 collaboration, we are 7 days a week working to ensure that patient flow is what it needs to be. Our goals are to keep patients local. They are to give patients the care that they need in a timely manner, and also assist us in customizing our protocols and care treatment plans as new evidence and best practices emerge as we learn more about this disease. We have responded in a responsive manner, not in a reactionary manner. And so I want to just take a moment to shed some light on that. As things evolve and change, as we learn more, the pace of that change continues to be very fast-paced. That is in an effort to be responsive to our patients, not to get into a place of reactionary crisis. As community spread continues to increase, I'd like to emphasize the responsibility that we as citizens need to have. We need to be smart, we need to care about each other, and we need to do that in an effort to help our community thrive. What we know at this point in regards to the COVID-19 vaccine is that it is coming what we believe to be very soon. There are daily updates that we are participating on in collaboration with the CDC and the State Health Department. There most likely will be a designated tier system protocol as to how that vaccine is administered. Like I said, those calls are happening daily and that plan is evolving. So we are prepared to do whatever we need to do based off the plan that will be given to us. This will most likely look like how we handle the flu vaccine within our health system. We provide those vaccines to thousands of individuals and patients, so we do have an operational plan that should we be given the opportunity to distribute that, we will follow suit with. At this time, we are having to restrict our visitors. That is because the community spread continues to increase and the amount of asymptomatic positives is very high. This is in an effort to keep our patients and our healers safe so that we can continue to provide exceptional patient care to those of this community and those surrounding us. At this point, we've been able to handle what has come through our health system doors. We have not transferred COVID patients out of our healthcare system that did not need a higher level of care. And so I know that that has been out there, and we just wanted to provide some clarity around that. Our ability to handle this has been a direct result of our departments working collaboratively together, working to create solutions, and working with the other metro hospitals to ensure that we are doing the best that we can for our patients. So thank you so much. I'm going to turn it over to Dr. Aaron Boyd.
Good morning. I'll apologize ahead. I'm probably not as eloquent as the previous two speakers. I am the Chief Medical Officer for the health system, also a practicing intensivist ICU doctor. I also want to thank the mayor for doing this, and also can't really go forward without thanking the frontline staff at our hospital, particularly the nurses and respiratory therapists and COVID units, ICUs, and emergency departments. What they do day to day is unbelievable. They manage complex patients and take care of traditional patients as well. I'm asked a lot of questions. All of us are asked a lot of questions daily, and there are not a lot of clear answers sometimes on those, but I'll go through some of those. I'm asked often, how hard is it? What's going on in the hospital? Is it difficult for the staff? And yes, they are fatigued. I would use words like anxious, scared. I would ask you, if I could provide you with PPE, would you go into a room with an active COVID patient who's coughing, short of breath, to provide them care, brush their teeth, help them go to the bathroom. Think about that. And these men and women do that every day, multiple times a day, multiple rooms a day, multiple days a week for 9 consecutive months. So it is real. It is something that they are handling in a magnificent way. We don't hear much about PPE anymore. I think that is in part due to the fact that our healers and staff have come up with creative ways to use PPE. Remember, most of those items are single use, and they've become multiple use items now because of methods that our staff has been able to create. And we have an inventory system and a contingency plan and a backup plan for the contingency plan concerning PPE. I don't yet know why some people get sick and some people don't. We're continuing to model that and try to understand that. It seems that there's still more unknown than known when it comes to who gets ill and who doesn't. We have seen teenagers, we have seen 50-year-olds, and we have seen 90-year-olds with COVID-related problems. They appear to be getting a little bit younger than they were in March and April as far as inpatients. The average age of the people I see is now less than my own, which is an interesting phenomenon. We do see people who get sick who don't have any underlying medical problems that we can appreciate. The other question I'm asked is, how did they get it? And I will tell you what they tell me. Most of them got it from a friend or family member who did not know that they were sick at the time. They were asymptomatic. Certainly people who live in nursing homes or long-term care facilities are at risk. And certainly people who attend indoor gatherings have been exposed, and often it's with family or extended loved ones as their source. There seems to be a couple of phases of the disease. The early phase where you're infectious but may not be symptomatic, and a second phase where there's more of an immune response, inflammatory response. And this becomes important as we try to develop treatments and management modalities for the disease. It's that later phase, that second phase, where you may become symptomatic, need oxygen, need to be hospitalized or seen in the emergency room, or certainly can end up in an intensive care unit. I'm asked about treatment. We are involved in national studies using convalescent serum. We're using antiviral therapy, steroids, but there is no magic cure at all. Just like many viral diseases, there's not specific treatment per se. We have seen improvement in patients with some of these modalities, which is encouraging, and all of that is being developed. We continue to practice best medicine, and it is changing frequently, often weekly. I'm often asked if I'm worried about the flu. Yes, I'm always worried about the flu. A flu outbreak could really create a twindemic of both COVID and the flu. So we're absolutely concerned about it. We're concerned about it every year. Our healers are ready. They have all had their flu shots, but it is a concern. And finally, I'm asked, what can I do to help? What can the public do? What can Oklahomans do to help? And I think first and foremost, get a flu shot. Go get that taken care of. Another thing you can do is not medically distance. We have people in the hospital today, and we have people admitted previously who are there solely because they stopped going to their doctor's appointments. They stopped getting their medicines refilled. They stopped getting routine procedures done and testing done, and created a situation where they needed to be admitted because they were not continuing to participate in their own health care. So they were medically distancing, and that's not what we want. We have the capability, capacity to take care of everybody That is something we continue to be able to do, and we encourage everybody to continue to get their health care as they should. Obviously, everybody should wear a mask, socially distance, wash your hands. Am I worried about the holidays? Yes, I am worried about the holidays. I think that's a time where groups get together that normally don't. It can be your family, it can be your friends, but you're normally not exposed to them. It also can be a time when we gather groups with young people and elderly people. So I ask everybody to pay attention to gatherings through the holiday season. And a mask will help you, it will help your neighbor, it will help us be able to take care of you. So that's really the message. Just help us help you. We can get through this, we will get through this, and Norman Regional is ready for any need you may have at any time. Thank you.
I am incredibly grateful for our partners at Norman Regional, and I want to thank Ms. McGill and Mr. Splitt and Dr. Boyd for being here today. Dr. Boyd and I speak almost weekly, it feels like, in our emergency management meetings that the City of Norman has continued to hold since this began. I believe we're at number 53. Another key part of our emergency management meetings and sharing information and being transparent with our public as we continue on during this crisis is Dr. Dale Bratzler. He is the Chief COVID Officer for the University of Oklahoma, which clearly plays a large role in the City of Norman. And now I will turn it over to him. Thank you for being here, Dr. Bratzler.
Yeah, thank you very much for inviting me, Mayor Clark, and I apologize that I can't be there in person, but my schedule did not allow that this morning. First, I want to thank all of the citizens of Norman, Cleveland County for the incredible work that you've been doing to slow the spread of this and slow the impact of this particular pandemic. You know, there is right now limited good news that we've been able to talk about nationally with respect to COVID-19, but there is some good news around communities like Norman and the folks in Cleveland County that have slowed the spread of the disease. And though we've seen increased number of cases both in the city of Norman and Cleveland County, the good news is that the rate of growth has not been anywhere near the rate of growth that we've seen across the rest of the state. I was looking at county level data, and we have now shown that there are many rural counties that have rates of increase of infections that are twice as high as Cleveland County. So there are a number of rural counties that are seeing more than 100 new cases per 100,000 population every single day, whereas Cleveland County right now is seeing too many. It's still 45, but it's much lower than many counties in the state. Again, I think it gets back to the point that Mayor Clark made earlier, that masks work. Some of you may have seen that the CDC changed their guidance on masks today and just announced that to reiterate a point that we've been making for some time. Not only does wearing a mask protect the people around you, but it protects you too. And so it's incredibly important, as we know that this particular infection is spreading in the community, that you wear a mask and try to do the physical distancing that you've all heard so much about. I've been particularly happy with the close working relationship we've had with the city of Norman and with the University of Oklahoma and the many different activities that we're trying to do to keep both the student population, our staff and faculty safe, but also we recognize that we have a substantial impact on the city of Norman and Cleveland County. And we very explicitly want to try to reduce any impact negative from the university. So as you know, we've had strict mask policies. We've worked very closely with Mayor Clark, the city council and others to make sure that we're aligning our activities as much as possible. We're going to do a lot of testing of our students before they go home for Thanksgiving, but we're now also working on for any students that come back into the city after the holiday break, we're planning to do substantial testing of the students when they come back to try to reduce introducing COVID-19 into the community that may have come in from some of those other parts of the state where rates of transmission are much higher right now. So all of us need to do our part. I'm not going to try to reiterate the points that have been made so many times before, but I'll finish with one important point that I think everybody needs to remember. Any person that you come into contact with could be infected. Remember that nearly half of the people who get this infection have no symptoms and look fine. They feel fine. They look fine. It could be a family member at your holiday gathering. Anybody could be infected, and so you have to assume that anybody you encounter in the community, in your home, in places of worship, out in shopping, or anything else could be infected. Protect yourself and also have the courtesy to protect those around you by doing what I'm calling universal COVID precautions, which all of you know. Wear your mask, try to maintain physical distancing or watch your distance, and wash your hands frequently. It's been such a great pleasure to get to work with the City of Norman, with Mayor Clark and others as we've tackled this pandemic. You actually are doing a good job. We're all seeing increased cases in the state, but the good news is that Norman, Cleveland County are doing much better than many other parts of the state. And the growth in cases has not followed the just extremely large growth curve that we've seen in the rest of Oklahoma. So thank you for inviting me today.
Thank you, Dr. Bratzler. So the goal of this press conference today was again to provide an update. Times are tough. There are many unknowns. There is perhaps a small light at the end of the tunnel, but no timeline on when we know we're going to get through this. I know that the rising numbers and unknowns, again, regarding a timeline for vaccines can cause great anxiety and fear, but we can all fight back by listening to our medical professionals and wearing a mask, getting a flu shot. I don't know how many times we have to reiterate it. Until COVID-19 is in the past, you will continue to hear us say that. I want to emphasize that what we are experiencing right now is not the new normal. This is not normal in any way, shape, or form, but we will get through this. While I cannot tell you when these tough times will pass, I can guarantee you that they won't last forever. We are a strong, resilient, and educated community. Let's continue to pull together like we did in the recent ice storm. Let's look out for each other, help each other, and most importantly, show yourself and show your neighbors some grace. We will get through this, and when we do, I am hopeful that all Normanites will be able to reflect on their actions taken during this unprecedented crisis and be proud of how they acted and how they helped others. Thank you again for joining us. For those watching, please share this information with your family, friends, and neighbors. Be safe, everyone. We'll take a few questions.
Are you considering any other restrictions in the city at any point, and what would trigger any new restrictions?
Thank you for that question. I'm not considering anything at this time. Everyone knows to wear a mask and limit your physical distance with others and those outside of your home. I do think that if numbers reach, and I don't know what those numbers are, to be honest, but we all know what we need to do. And so hopefully people will take those actions without suffering the loss of a loved one, which unfortunately tends to be the thing that gets people's attention. So for now, we're sticking with the mask mandate and continuing to urge our state officials and our governor to pass a statewide mask mandate. Our numbers of casualties are astronomical. We've already reached the numbers that we had predicted for Thanksgiving. Imagine if we had a statewide mask mandate put in place when Norman put it in back in July. How many lives would be saved? How many family members would be able to celebrate the holidays?
Yes, my question is for the medical professionals. One, I would like to know how closely this resembles the polio epidemic that we suffered in the United States. And two, are there people who would be normally dying that they attribute to the COVID? Is there any distinction between that and what is going on?
While Dr. Boyd's coming up, I'll repeat the question. Is this similar to the polio crisis?
No, has he compared it
Okay.
to the polio crisis that we suffered in this country, in the, people tell me from thirties to about sixties, something like that. And are there any people who are dying that would be normally dying that they attributed to COVID? Maybe the doctor doesn't have the professional wherewithal to determine the death or whatever, but he just said, well, this is a result of COVID.
So the first question is, fortunately, I'm not old enough to be part of the polio timeline, so I haven't compared it to that. Second of all, the reason for death is still examined just like it always would be. There are people who die who are tested positive for COVID that did not die related to COVID, and we make that distinction. We also obviously make a distinction if COVID or COVID directly related issues resulted in death.
Thank you, Dr. Boyd.
I have a question for Boyd. What is Norman Regional's, hospital bed capacity as well as ICU capacity? Has that increased significantly, and how much capacity do you have left?
We are fine and have been really throughout this entire time as far as patient rooms, beds, ICU space, all of that.
So you're not worried, as opposed to capacity?
Well, I wouldn't say I'm not worried if things don't turn around, but currently we're fine and have been fine, and we're able to take care of any and all people in Norman and surrounding areas without any problem.
Are you guys taking patients from other hospitals, whether from the city area or any other parts of the state? Are you guys taking transfers?
So what we have is an incident command type of a scenario where we're communicating with all the hospitals and being transparent with who has beds and who doesn't. We have not routinely taken transfers at this time. We may, if that's necessary in the metro. We also do take transfers from all over the state on a regular basis, and that continues, but that's not directly COVID related.
And I want to emphasize that because we still have the space, because we're operating in as normal as can be within our experiences, please get your preventative health care. There is room for it. There's plenty of opportunity for you to take care of yourself during this pandemic, because life will continue on afterwards, and do not let yourself or your loved ones get behind in your health care. Yes?
You mentioned the economic impact. Do you anticipate the city using any of the remaining CARES funds to help small businesses?
Yes, I do. We'll actually be discussing that more in our study session on Tuesday.
Do you believe that, kind of the Norman's kind of trend upwards since college students come back, do you think the college students kind of like lack of adherence to the mandates they have in place and to the recommendations, the medical officials kind of plays significant role in the rise of COVID cases within Norman?
I do not. If you look at, again, as Dr. Bratzler pointed out, the new cases are rural right now. Yes, we had an increase, but we also had 20,000 people added to our population. So I am very proud of the students at the University of Oklahoma and how they're acting on campus. And while, of course, we have obviously had some concerns with social gatherings, we've also had social gatherings that aren't student-related that have caused issues. And so being home to the flagship university, but seeing lower numbers in Cleveland County, I think shows that you cannot blame young people for this. Everyone needs to be responsible for their own actions during this pandemic.
My question is for Dr. Boyd. Can you elaborate on the surge plan, and if Norman Regional is currently, are you in that surge plan, or can you talk to us a little bit about that?
There is a surge plan that is a collaborative between all the hospitals. It's a tiered system that's communicated daily and discussed daily. We are not in any type of tier that requires any special or different change right now, but we could be.
All right, thank you all for joining us today. I appreciate you helping us communicate these very important messages during this unprecedented time. Be safe.